Have you ever wondered how health policies work? And generally, what are health policies? These are generally guidance documents that actually inform how different stakeholders and different pieces in the healthcare ecosystem should be working to ensure we have access to quality healthcare services in an affordable manner, and every stakeholder has an enabling environment and ecosystem for them to do that job. And then who are the people who drive policies? It should be me and you as individuals. It should be the legislators from a government policy perspective, that is the parliamentarians, and also senior health policy experts who've worked in the government and actually understand the policy making processes. But then how do they get to that level? It starts from an early age, and that is what we are keen on from a culture standpoint. How do you as a young person get to understand the policy making processes? Understand that you as a healthcare professional, not getting a job, there's a policy angle to it, and therefore you need to be able to inform these policies to ensure employment will come into place. You as a young person working in healthcare organizations and delivering healthcare services, if you're not able to access the products that you need to supply and actually to offer to your patients, then it means there's a gap in the policy system, and actually that policy gap will ultimately lead to an intervention not being implemented where it needs to be implemented, and need to understand that as well. So having that overarching understanding that policy is the guiding framework on what needs to be done, who needs to do it, and how the governance principles on where it works, then as a young professional and a young healthcare worker is to understand, how do I engage in policy? How do I understand the policy making process? And how then do I contribute in ensuring we have market driven, responsive, and actually enabling policies to ensure that we're able to achieve universal healthcare coverage? As we're going to host the second annual Youth Voices Summit from 1st, 2nd, and 3rd of December at Amref International University under the theme Activating Youthful Leadership Towards the Realization of UHC, it's imperative for us to work on ensuring that young people are meaningfully and actively engaged in informing policies, they understand the policy making process, and are willing to be engaged long term in informing these policies. And that is why, as Kenya Healthcare Federation are coming on board as our partners for this event, and from their policy advocacy perspective, from a private sector engagement, then you as a young person, you as a professional in the healthcare space, who is willing and keen on learning on policies, this is the opportunity. Come engage with people who do the work, come learn from them, and engage in the long-term activities that you're planning to have so that you're able to understand the policy making process, understand the way policies work, and actually understand how you as an individual can contribute to policy making, can become a policy maker, and can contribute to ensuring we have a sustainable, responsive, and resilient healthcare system in the nation and in the continent at large. Your role as a policy maker starts now with us when we meet at Amref University during the second annual Youth Voices Summit, and we're asking on you to make a commitment that you're going to drive this conversation and you're going to engage with peers so that we make it a success for all of us. Thank you so much, and let's meet on 1st to 3rd of December during the summit. Thank you.